So my name is Korey Searle. I just graduated from the University of Michigan, Department of Orthodontics, and I grew up in West Michigan in Grand Haven area. I'm excited to come back to the west side of the state and start practicing. The reason I pursued a career in orthodontics is that I had orthodontic treatment when I was a young child. So I had a really big overbite that I was able to get corrected by going through orthodontic treatment, and it really changed my life. And then I also had a great mentor after going through that orthodontic treatment who was an orthodontist and loved kind of how he was a part of the community. And then I got to job shadow him, and then the more I learned about orthodontics, the more I fell in love with it. My education really started at the University of Michigan for undergrad. I got a degree in neuroscience, so not directly related to teeth, but it's in the head. So that's kind of why I picked it, because a lot of the prerequisites overlapped with what I needed for dental school. And then for my undergraduate studies, I went to dental school at the University of Michigan as well for 4 years, where I got my DDS degree. And then after that, as you guessed it, I stayed at the University of Michigan for an additional 3 years and got my degree in orthodontics and dental facial orthopedics, and got a master's degree there as well. So what drew me to the HPO team was that I got to know Dr. Hannapel from working with him for the past 3 years at the University of Michigan. I got to meet Dr. Pellillo and her husband, and then I came here and did some practice visits as well and got to meet the team here. Loved kind of how the team operated, how everyone got along, and how the practice is really patient-centered and patient-focused. Orthodontics should really be individualized care. And so my approach to treating patients is really that I try to treat everyone like family. And so anytime you treat a family member, you really pay attention to what they want, and you want them to have a great experience and love coming in. And so I really try to keep that same mentality when I treat patients. And then I love connecting with patients. I love talking about their day-to-day activities, what they're doing in the community. I would say that's probably my favorite part of the job. And so I just love, having a good laugh in the office, hearing about what they're up to these days, and connecting with families, I would say. I'm really excited to come back to West Michigan as it's, where I grew up and my family is here. And I also really love kind of the close-knit community that they have here and how down-to-earth everybody is. And so I'm really looking forward to becoming a part of this community and starting a family here. But I'm really excited to work with all of you and meet all of you. And I think we're gonna have a great time creating beautiful smiles together.